Have you ever cut yourself or had surgery and ended up with a scar that was raised, bigger than the scar that originally started, itchy, painful, and noticeable to not only you, but the people around you? What we're talking about is not a normal scar. It's not a flat scar, and it's not a red scar. This is a keloid scar. Hey guys, Dr. Krasandi here. You may know me as Doc Vegas on Instagram and on my social media accounts. And today we're going to talk about something that I find to be very interesting, and that's something called keloid scars. If you have a keloid scar, you know exactly what we're going to be talking about. But what you may not know is how we can treat them now in our office and get almost 98 to 99% clearance of the keloid scar in only one treatment. It's an amazing new technology based on principles that have been around for over 30 years. But today we've brought it into our office and we have made it available for you so that you can have surgery without the fear of the scar. So the question is, can you stop a keloid scar before it forms? Unfortunately, there's very little that we can do to stop that process short of interventions such as steroid injections, compression, excision with post-operative radiation. And that's what we're going to talk about today. So there are a couple of myths about, what you can put on scars. And, one of the things that used to be a big myth is that vitamin E would help. And actually, we've seen that vitamin E can actually affect the scars and cause more problems than good. It can cause some folliculitis. Coconut oil, aloe vera, products such as Mederma, there's a whole host of different things. And none of them have been really scientifically or clinically proven to improve scar outcome. At the end of the day, there are a few things that do work topically. One of them is steroids in high doses, steroid injections, but in general, those are not over-the-counter types of steroids. These are much higher doses than the Cordaid and the Cordaid 10 that you would get at the drugstore. It's oftentimes important to look and see if there's actually any clinical study behind it. And it's very easy. Take whatever you're using, Google the name of the product, and look for clinical studies showing efficacy. If you can't find any, then it's unlikely to be a benefit. So the surgical process for treating a keloid scar is a two-stage process. The first stage is the excision and removal of the scar with its closure in the operating room. Or if it's a small enough scar, we could do it here in the clinic in our procedure room under local anesthesia. The second step is the post-operative low-dose radiation. And that occurs on days 2, 3, and 4. The radiation is broken up into 3 segments. And the reason for that is, if we were to deliver it all at once, it may cause changes in the colors of the skin, burns, and things like that. But by breaking it up, delivering that same energy over 3 smaller doses, clinically it's shown to be not only safe and effective, but with the least amount of side effects and downtime. Now, when we say short term, it takes literally 30 to 60 seconds in each area to radiate the spot. And questions about radiation abound, but we'll get into that in a minute. Let's talk about the whole process and let's get into the nitty gritty of it. So say you have a keloid, right? I'll see you in clinic and we'll take a look at the scar. And we'll evaluate whether or not we can do this in the office or in the operating room, depending on if it's a sensitive area where getting it numb is going to be difficult in the office. Once we decide whether we're going to do this in the office or the operating room, we decide on a plan. Can we do the keloid all at once, or do we have to do it in stages? And typically we do the keloid all at one shot. Once we figure that out, we'll get you scheduled for the surgery and do it either here in the office under local or in the operating room. We're going to either put you to sleep or numb you up in the office. If we put you to sleep, there's really nothing to do. You go to sleep, we do the work. If we put you into the office category where we're doing it under local anesthesia, what it's going to take is a few shots of Novocaine-like drug called lidocaine, which will numb the area and allow us to cut out the scar. You won't feel anything, which is great. And when we close it, whether it's in the OR or in the office, we close it under sterile precaution procedures where we're gowned and gloved and we treat it like a sterile procedure overall. The closure of the scar takes place in several layers. We begin in a deeper layer, an intermediate layer, and a superficial layer. And whenever we close these types of scars, we use absorbable sutures which don't need to be taken out. The final step is to put a very thin film over it called a tegaderm or an opsite, and then that's it. You go home. Typically, patients will say that they have some soreness in the area, but pain is generally well controlled with over-the-counter pain medications such as Tylenol and Advil. The following day, it's very important to show up at the office, because this is where the low dose superficial radiotherapy occurs. And when you come in that day, we will have the area marked out. And typically a scar is a straight line, but sometimes they can be curved or circular. We'll mark around that scar and we will create a lead template specifically for that scar. Once we have your scar marked out, we'll make that template here in the office. And sometimes it'll look something like this, okay? We put a little tape around the edge so as we file down the edges of the lead, there's no sharp corners, and we'll label it sometimes right thigh and things like that. What this central part is the area where the scar is gonna be. And so now we have our template. The next step is to pick out a collimated cone to figure out exactly how much radiation width that we're gonna deliver with our device. And using the Sensus SRT, we have a wide range of sizes from 1 centimeter all the way up to 16 centimeters. So we're able to really treat some really big scars in one dose. For the larger scars, sometimes we can have scars as big as, a whole tummy tuck scar. And for those, we'll break down those scars into 2 or 3 segments. So here's a template that we use for a breast incision in a breast type of lift. And you can see we've broken it down to several different segments. So we've done one segment here, another segment here. And oftentimes we'll flip it over, do another side segment here. So in this way, we could treat really big scars, really long scars, all in one day. And obviously we break that up into 3 segments like we said. We're in our office right now at VIP Plastic Surgery, and this is our SRT Sensus room. This is the room that we custom built for this procedure. So let me take you inside the radiation center here and show you what it looks like. It's not that intimidating, trust me. I know it may seem like it's a little underwhelming, but this is it. It's a small device. But with this small device, we're able to do some tremendous things. The SRT 100 by Sensus has been around for about 5 to 6 years. If you want to look it up, it's a publicly traded company, which means that this isn't some type of technology that was just, shipped from overseas or just somebody developed it in their backyard. This is a company that has accountability, FDA approved, and it's gone through a significant vetting process so that it's safe inside. When patients are coming in for treatment, we oftentimes have them lay down, and we provide several different protections, including a thyroid shield and a lead apron, and these are extra precautions. But we look before at the lead cutouts, the templates, and here we have our applicator set. And like I said, they come in a variety of different sizes. From the very small, so this would be for a 2 centimeter sort of scar, something really tiny, all the way up in the standard round to about a 10 centimeter. This is actually a 5. 10 centimeters in the next drawdown. And this is for slightly larger sort of keloid scars. And it allows us to bring this right down, and I'll show you how it works in a second. And then we have all the way up to our 16 centimeter bell. So this is for slightly longer scars. And this allows us to treat a wide variety of scars, whether they're small, like earlobes, big chest scars, tummy tuck scars, breast scars. Gives us a lot of versatility. And obviously the machine is off, but this is just an understanding of how it works. So once it's in there, this gives us the ability to kind of bring this over, just like you were getting a dental x-ray. And we bring this in on top of your template. We'll grab one of those, and you bring it down, and that's where we're gonna treat. We lock it into place. We have a monitor right there to make sure that you're not moving. Step outside, fire the button like anybody would do an x-ray in a dental office, and somewhere between 40 seconds and a minute and a half go by, and then we stop. What do you feel when that happens? Absolutely nothing. So patients always ask, what does it feel like to go through this procedure? And they're often surprised once we do it that it's so easy because you don't feel anything. It's a beautiful thing. So what you do is come in day after surgery, the following day, and one more day after that. Take the dressings off, and you're free to go until it's ready for a follow-up. Simple stuff. So how do you find a plastic surgeon to do this for you? Well, we're here. You can always fly to Las Vegas. It's easy. You need to be here literally 4 days. And there's a lot of things you could do in those 4 days in Las Vegas. We won't get into that. So you can find a physician on sensus.com, sensus.com, or look up the SRT 100 by Sensus and get a little bit more information. Or you can fly to Las Vegas and come see us and we'll take care of you. If you're interested in the latter option, meaning VIP plastic surgery, you can always contact us at 702-508-6022. Email us at info@vipplasticsurgery.com, all one word. So after you excise the keloid and you've done the SRT 100 radiation, what happens next? Well, it's time to heal. And healing can take a varied amount of time depending on your own particular makeup. In general, the scar will continue to heal over the next 3 to 4 weeks. And after that period of time, generally after 4 weeks, I clear my patients to return to the gym, to swimming, to all sorts of normal activity. In darker skinned patients, you may see a little bit of light discoloration around the scar from the area of radiation, which usually resolves within 12 to 14 weeks. In most patients, the area becomes a little bit itchy, just like any scar would as it's healing. But we'll know by 3 months whether the treatment has been successful. And so far, I haven't had a single recurrence using the SRT. Now, the statistics show that the improvement is somewhere in the ballpark of 97 to 98%, with a recurrence rate as low as 1 to 3%. And so far, we've seen pretty similar results in our practice. We believe that if you suffer from keloids, that there's really only one treatment that makes sense: excision with postoperative radiation. But in the past, in order for us to do this, we had to do the excision and then coordinate with a radiation oncology center outside of our office, which oftentimes would never happen. Because in those facilities, the priority is to cancer patients. And getting a person on a schedule 3 days in a row sometimes doesn't work with not only the individual schedule, but the center schedule. The beauty of the SRT 100 in our office is that we're always available for our patients. And we're able to do this 7 days a week. So if we do our surgery on Thursday, we could see you on Friday, Saturday, and Sunday if you're a fly-in patient. And that allows you to take the least amount of time off from work. And at the same time, you can enjoy some of the attractions that Las Vegas has to offer. Hopefully this has been a helpful sort of walk through the stages of keloid treatment. We've talked about some of the myths, and I've shown you a way in which you can treat and effectively get rid of keloids with a 98% certainty. If you have more questions, let us know, and be sure to hit the like button and the notifications button, and we'll keep you up to date. Thanks for watching.